Hello, my name is Dr. Erin Denil with Rejuvenate Life Chiropractic, and today I want to talk a little bit about nervous system disturbances. So, I have a statement up here that's pretty bold statement, right? Nervous system disturbances are underlying causes of disease. So how on earth would that be? Well, our nervous system is going to control and coordinate all of the organs, tissues, systems, and glands in the body, as well as, control pain, temperature, pressure, proprioception, which just means where your limb is in space, okay, how that works. How is this important? Well, the body needs to communicate to the brain, and the brain needs to communicate back at the body, okay? So a lot of times in fancy science terms, we'll call these different things. We'll call it afferent information if it approaches the brain. And if it is going from the brain to the body, we will call that efferent because it exits. Okay, so if you ever hear someone say it's disafferentation, okay, abnormal communication from body to brain, disafferentation, simple to break down what it means. If we have a nice communication, everything's working, we're understanding what's going on. So for example, it would be like a cell phone transmission, that we're getting our information from one cell phone to the other without any gargle-do-guck or waffled, communication. So it gets very frustrating if you're on the phone, especially let's say you're talking to a spouse and you're going, hey honey, can you pick up some eggs and some yogurt, a bottle of wine, and some chocolate on the way home. Dark chocolate, very low sugar content, right? High in the dark. And you'd say, hey, can you bring those home? And if the person only hears part of that information or not any of it at all, how are they supposed to get what we need on our list? Okay, so that's just an example of what happens. So if this safety pin were to open up, we call it a safety pin cycle. If that safety pin opens up, it disturbs the information. We're not getting that same information. We're not getting what our body needs in order to properly control and coordinate all of those organs, tissues, systems, and glands that nerve is going to talk to. So it's very site specific as far as which level of the vertebrae, okay, of the spinal cord would be affected. So which level would this happen at? Okay. If we don't have that communication, it's going to lead to that decreased function. Hey, is your spouse very efficient at picking up what you want from the grocery store if they don't know what you want? Right? We often say, as married couples, we say, I'm not a mind reader. Well, we expect people to be. Well, our brain is not a mind reader either. It needs that proper signaling. So overall in chiropractic, we are concerned, at least if we're a wellness-based office, we're concerned with those nervous system disturbances. We want to make sure that we are correcting the underlying cause of disease in most cases, okay? Many disease processes are going to start with a lack of communication, okay? What then could lead to all of this, okay? So what could disturb the nervous system? I'll get to that in the next video, which will be talking about physical, chemical, and emotional stressors that are going to affect this nervous system. So stay tuned for the next one. But I'm Dr. Erin Denil with Rejuvenate Life Chiropractic, and I hope you are having a fabulous day.